This is the platelet counter and the software and the laptop that demonstrates the results. The platelet counter is actually counting the platelet number either in whole blood or in platelet-rich plasma. I think the real benefit of a device like this is that it really approaches the point-of-care situation where you have a small and dedicated device requiring only a small sample of blood that can be collected through a capillary puncture, which allows to do this platelet counting and ultimately also characterization of platelet function in a real-life setting. So that could be either in a general practitioner office, but also somewhere in a rural area in countries where platelet-based diseases are prevalent. And one of the settings that you may consider is in a country where malaria is prevalent, or dengue, hemorrhagic fever, and where platelet counting is actually one of the early markers of severity of disease. So if you can use a device like this in really a setting without a fancy laboratory, that will be really helpful. So far we are very satisfied about the data that look really good and consistent, and our technicians are happy with the way that the device works. So I feel we are confident to make the next step then and to test it into a practical situation. We are quite confident now that within a range which we consider the normal range of between 150 and 350, and also up to a level slightly higher, so approximately 500, 600, the performance is very good. At ranges outside that margin, we need to adjust the dilutions. So after initial testing in our laboratory, where we looked at different markers of accuracy, reproduction, the detection level, etc., we're now ready to proceed to include also other centers to do this in an international way. And therefore we have approached our colleagues in Italy, Bergamo, and in Mainz in Germany, who will at 3 different locations then test the equipment to see how consistent these data are when you do it in different institutions, including different patients and different laboratories. So the next application that you can consider is to also look in patients with thrombotic diseases, where except for the platelet count, also markers like the platelet volume and also platelet characteristics like degree of platelet activation with activation markers could be taken into account. And this device actually has the potential to adjust it or to apply it in that direction.